Hey everybody, welcome to this episode of Compassion and Courage, Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Today, I have not one, but two awesome guests, and I'm going to ask both Sarah and Carrie. Sarah, can we just start with you, and could you just give us a little bit of your background and your bona fides and what you do?
Sure. I'm Sarah Grenon. I am a nurse. I started out as an RN and have just recently, over the last year, completed a doctorate at Rush University for advanced public health nursing. I teach undergraduates at Duke University and just love nursing, have always really been in public health nursing. And Carrie and I used to work together at University of North Carolina at Greensboro. And so we're excited to share with you what we've done with one of your books.
I'm excited to hear that, but before that, let's hear from Carrie. Carrie, do you mind sharing a little bit about yourself with us?
Yeah, I'm Carrie Hill, and I am also a nurse. Just like Sarah, my background, though, is in pediatrics, oncology, and critical care. I am an educator as well, and um, started my career off in a different realm. I was a researcher and then decided I wanted to deal with people instead of lab rats, and so went to school for nursing and became a nurse and loved it, and went and got my doctorate at the University of North Carolina at Chapel Hill and became an educator. And I've recently left academia and now work on the clinical side in the hospital, in nursing education and professional development.
And we could certainly talk about both of these areas too, right? Nursing professional development and academic nursing, all in the same field. But the reason that we were going to talk today was because I was contacted by Sarah several months ago, and she asked me a question that it was such a no-brainer whenever she explained uh, what she was asking and how she was going to use the book. And can we just go back to that, Sarah? Can we go back to the time that you all were working together and using one of my works in your coursework?
Absolutely. So it was actually back in 2020. I had a colleague who had been at a nursing conference that you were speaking at, and she got the book I'm Here, and she brought it back and she shared this book with me. And I sat down and read it in one setting. It's such an amazing book, and I thought, gosh, every nurse, every healthcare provider should read this book. It should be a requirement. And and it was during the time that COVID was really ramping up, and we were having asynchronous classes and synchronous online Zoom classes, and so we were trying to think of innovative ways to teach some of the concepts that we had been teaching face to face. And so Carrie and I talked and decided that we would adopt this book as a way to incorporate teaching compassion and kindness to our students. So that's kind of what we did. At that point, I had reached out to you, and you actually sent me a list of questions I think another educator had prepared to use in book discussions, and then we kind of just jumped off from there.
So what did you learn? What did you learn whenever the students started reading the book?
Well, I'll let Carrie share about how we actually
Yeah.
incorporated it and what our outcomes were.
So, I'm a qualitative person, and one of the things that we did is we asked students to write about what they learned. We had discussions in class on Zoom, but we also wanted them to write about what they learned. So that maybe we weren't just putting them on the spot and asking them in a Zoom session, but instead they could really think about it. And some of the things that they wrote that they learned were really, really impactful. You could tell just how much they were impacted by what they were reading. We had students that said that they had never thought about healthcare from a patient's perspective. They were brand new nursing students, and they're all about learning skills and being able to successfully demonstrate skills. But they revealed that they didn't realize that they were doing those skills on an actual human being. And it was great to take themselves out of the demonstrating of a skill and actually communicating with a person. They really appreciated hearing from a patient's perspective and not from a medical professional. So, Sarah and I are nurses, and we can talk all day long about what it's like to be a nurse. But they were really appreciative of hearing the other side, what it's like to not be the nurse, but to be in the bed in a hospital. A lot of them said that it really reinforced why they wanted to be a nurse to begin with, that they really were looking forward to having a career where they could provide positive and memorable experiences for the people within their care. One of the things that in this time of a lot of nurses talking about being burnt out, one passage that a student wrote really stuck out to me. This student said that they had been working for years as an EMT, and they said, unfortunately, I have a burnt out attitude that is ingrained into the culture of the job. And they said that they didn't like to admit that, but this book really humbled them and proved them wrong and really brought them back to reality about what is important in healthcare. So that was really, really good to hear. So overall, I think that the book had a very, very positive impact on the students, kind of got them out of their silo of thinking about all these neat skills and things that they're learning, and thinking more about the soft skills of how to communicate and how to care for people and be compassionate.
First of all, I'm glad that anything can help those students. Then, of course, it makes me have the warm and fuzzies to know that it was my book that was used for it. You talk about this EMT who is saying the signs of not wanting to admit being burned out, and reading the book and getting some different perspective and hopefully a little bit of inspiration and renewed life into that career. I think all of us in the caregiving professions, and I just put myself in that role, even though I am not clinical professional, but all in the caregiving professions, I think you certainly have the possibility and maybe the probability that compassion fatigue and burnout are going to come along at some point. What have you done when that's come up in your own careers?
That's a really good question. I think as nurses, we come in thinking movies, nursing is like movies where everybody just runs around as a stat and looks pretty and, but it really is a messy, smelly, heart-wrenching job. And working in oncology and end-of-life cares, which is what I did before I got into being faculty, I would go to 4 or 5, 6, death calls in a night working for hospice. And it was really hard, but it was so humbling at the same time, being able to be with somebody at what could be the very worst moments of their lives, or being invited to be with someone as they're dying, really is such a lesson in humility. And that's really what kept me going, is because people would just say, you put a wet rag on my head, and that just made my night. And so that's really what kept me from getting burnt out. But once I did get those feelings of I'm not being as compassionate as I could be, I realized it was time to transition into something else. And that's one of the wonderful things about nursing is the transition ability throughout your career lifetime.
How about you, Carrie?
Similar to Sarah, I think, I said my background was pediatrics, and I spent most of my career in critical care and oncology. And so if you see me and you're a patient, you are typically having the worst day of your life, unfortunately, or your child or baby is having the worst day of their life. And, certainly I've seen some things that I don't want to ever think about again. And you just have to realize that you might not be able to make the day better for patients and families. Like I said, because I'm meeting people on the worst day of their life, but I always strove to not make it worse. I might not be able to um, cure your child's cancer or save them from whatever is happening to them, or I can't change that diagnosis, but I can certainly not make it worse for you. And if I can, make it a little bit better. And I think also, um, I was on the other side of it for a long time with my father in and out of the hospital. And so I was that family member who had nurses care for my family member who you could tell that they were burnt out or that they really didn't want to be there. Um, and I know how that felt as a family member.
Mm.
And I just kind of made that decision that no matter how burnt out I was or distracted I wasn't going to show that when I was in front of the patient or family. I'll do it outside in the hallway, but not in front of the patient and family.
Sometimes easier said than done, right?
Yes,
Uh,
absolutely.
so you mentioned your father going through end of life care. Is that correct?
Well, it wasn't supposed to be end of life care, but that's what it ended up being. Yes.
Okay. Okay. So this kind of gets into one of the questions that I always ask my guests, and it's the same question that I put forth to my pre-meds every semester. And that is if you can share a story or a narrative about a time that someone was there for you or that you were there for someone else. Hence, like Jennifer in the first chapter of I'm Here was there for me that night. Um, is there a related experience that comes to mind for either of you? Maybe it was the situation with your father, Carrie. And by the way, I'm sorry to hear about his passing.
Thank
But
you.
is that the story that you'd like to share? Or do you have another instance that you'd like to share?
Um, I can't, you know, the time surrounding my father's death in the ICU was kind of an unexpected but expected at the same time. If that if that makes any sense,
Yeah.
he had a terminal illness, but we just had no idea that it, um, the end was coming so quickly. Um, and there are a lot of things I remember about that time, and certainly a lot of things I'd like to forget as well. But thinking about your question, I think that one thing that always has stuck out to me, and I shared this story with my students every chance I get. Like I said, I was a pediatric nurse, and I was coming in um, for a shift one morning on day shift, and I was getting report from night shift, and the night shift nurse had some things to say about the family at the bedside that were not so nice. Um, and I just listened and went about my day. And that morning when I walked into the patient's room, um, I did what I always do is I introduced myself, and this was a child who was a teenager who was chronically ill, who was needed total care from birth. And the mother was at the bedside looking like she had lived 1,000 lives already. And, I said to her, these are the things that we need to do today. But I'd like to hear from you, Mom. And can you tell me how you want the day to go and how do you want to participate? And I'd love your help if I could get it. And I want you to tell me about him and tell me what you'd prefer. And it was kind of like a weight was lifted off her shoulder. I could see it, you know. And she said, I've been coming to the hospital with him on and off for 17 years, and no one's ever asked me that question. No one has ever asked me to participate in his care. No one has ever wanted my opinion. And I said, well, I'm sorry that that's happened to you, but I don't know him. You're his mama. You know him. And I'm going to need you to be my partner in taking care of him today. And we just had the best shift. I mean, I just had the best day that day. And she told me so many wonderful things about him and how to take care of him. And, at the end of the day, she said, I'm so sorry you're not coming back tomorrow. I'll never forget what you did for me today. And that meant a lot, but it's also, I didn't really do anything out of the ordinary other than what you should do when you're taking care of a patient and a family. And so I try and always share that with my students and other nurses to let them know that, you should always involve the family members in care because they truly want to be involved.
And they're oftentimes the holders of medical knowledge about this family members.
Yes.
Right?
Yes, absolutely.
So, wow, it's a
Absolutely.
beautiful and sad story, too, that,
Yeah.
Poor thing had gone that many rounds through the healthcare system with a sick child. And it just takes being human, though, right? Acknowledging that she's there and that she can be a part of this and help all
Absolutely.
at the same time, right?
That's why I always said she's the mom. She
Yeah.
knows him. I've never met this poor child
Yeah.
in my life, and she has spent 17 years taking care of him. So, of course, I am going to ask her opinion. I am going to want her to be on my side. So it's just
Absolutely.
smart. It's being a smart nurse. That's all. And a
That's
compassionate nurse.
smart nurse, right? We often talk about compassionate and quality nurses, but smart nurse, I like that too.
Yeah.
Well, Sarah, how about you? Is there a story that comes to mind whenever I ask about being there for someone else or
You know,
someone being there for you?
similarly to Carrie, my mom died early too, and it was about 7 years ago. I was pregnant with my second child at the time, and it was probably one of the worst times of my life. And um, I had people come and just sit with me during surgeries and things like that, and then had the opportunity to repay that for a friend who lost a loved one. And so during that time, I just learned that, silence truly is golden. And it's not necessarily what you do for patients or families or friends or loved ones. Sometimes it's just sitting there and then them knowing that there's someone there. I learned that with families in the middle of the night when it would be, 3, 4 o'clock in the morning, and we're waiting for the process to happen after a loved one dies, and you're just sitting with them and they're crying and they're processing, and you don't have to say a word, but it's ultimately the best conversation you've had all day in some instances.
You say, you're not doing anything, but yet you are. You're giving a person your presence, and that's the greatest gift we can give another person. It may not feel like we're doing anything, but we still are, right? It's actively being there for another person that is the definition of compassion. So, I wanted to ask you, Sarah. I know we kind of got off topic of the book and the findings. Whenever you were looking at the student letters and reflections and such like that, were there any things that stood out to you?
I think the biggest thing was that they started recognizing patients not as their illnesses. A lot of times we'll say, patient so and so with asthma, or the patient down the hall who has diabetes, and we define patients by their illnesses. And doing this book study and hearing about the experiences that you had and things that meant the most to you, your music, or people talking, you saying they told me before they were going to touch me, it really shared with the students that you have this psychological, you have the psychosocial, you have trying to be culturally sensitive to clients that aren't like you. We talk a lot about social determinants of health, and it's really difficult for the students, particularly that I've taught, who have typically come to me defined by their grades or their task performance, to see something other than this is another task. And so to be able to read your words and see your pictures and see what meant the most to you, yeah, all those skills are really, really important. And we don't want nurses that can't do those skills, but kindness, grace, compassion, all of those things you have to have in order to holistically care for those patients. And I think that was the biggest takeaway from multiple conversations with them.
I'm so glad to hear that it's, I often say in keynote speeches that my nurse Barb didn't treat me like a prognosis or a diagnosis or a room number or a trauma patient or a trach patient. I was a human being, right? I was a human being, and that's really what we're trying to get across to everybody. It may be patient number 6 for you for the night, and that's a long, heavy load of patient care. But that means a lot to that patient in their experience and in their time of need too. Where do you, this is one of the questions that I've kind of gotten used to asking people, especially in positions as you all are, but what is exciting in the world of nursing? What's on the horizon? What's on the future that makes you hopeful and excited?
I still love the first time I see students have that light bulb. Maybe they hear a blood pressure for the first time, or they just really get it. And that makes me hopeful for the future. I was a student, had lots of challenges growing up until I found nursing. And once I found nursing, I just went with it and I loved it. And I didn't make the best grades, but I love teaching it. I love everything about nursing. And I love that we're really starting to transition to preventative and primary care and keeping people out of the hospitals more as much as we can. Being from a public health background, I'm excited that the rest of the world has seen how important community care, preventative and primary care is. So I'm excited about the future of preventing illness before it gets into that tertiary care.
And I believe, Sarah, I also saw that you have an interest in rural mental health. Is that right?
Yeah. So I completed my doctorate last year, and my project was based in a small rural community in North Carolina called Rockingham County. And it was not my plan to focus on mental health, but after doing a population and community assessment, I identified that the patient to provider ratio in Rockingham County was 1 to 760. And so in the midst of COVID and the exacerbations of anxiety, depression, substance abuse, we needed more people that could intervene in a mental health crisis. And so I identified a program out of Houston, Texas, and it's called the Empower Program. It's a free program, and lay people can take the program and become those mental health crisis interventionists. And so we did that in faith-based communities. And so now I'm happy to say that there's 60 plus people in Rockingham County that can provide that initial mental health crisis intervention.
That's a beautiful thing. That's a beautiful thing. Thank you for sharing that and doing that. That's got to make you feel good at the end of a PhD or a doctoral program to be, hey, wow, there's something that's going to carry on, and this dissertation isn't just going to be put up on a shelf somewhere.
Right. Yes. And just like the work that we're doing on your book, we're planning on trying to work on disseminating the research that we've found, the qualitative information that we've gotten from the students. And so we're still working on trying to get that work published to get more information out there about patient-centered, compassionate care. So that's our next step in dissemination of the work that we did.
Hint, nurse journal editors and nurse journal readers out there looking for a publisher. So yes. Great. And Carrie, I wanted to give you the opportunity too to share the things that are exciting or hopeful in nursing or healthcare that are on the horizon for you.
Well, my answer is a little bit similar to Sarah's in that, when I was in the academic world teaching not yet nurses or, students on their way to becoming nurses, I loved those light bulb moments, like Sarah said. And now that I'm in the hospital, I am, teaching people who are already nurses. And even though they have finished their degree, they are nurses. And many of them have no plans to ever go back to formal education and are staying exactly where they are. There's always something that they can learn. I like how, I was in academia for a while and now I'm in the hospital system, and it's nice to see just how many opportunities there are for nurses to learn more once they're in the hospital and to participate on different educational projects and actual dissemination within whether it be their unit or their hospital or regional area about things that they've learned or projects that they've done. So I'm excited about that. I'm a research nerd, so I like that type of thing.
I hear you with the research nerd part, but I also hear both of you with the educator's heart too. That that's why we do it, right? We do it for that light bulb moment whenever that student clicks. They truly just get it, and that's why I teach. That's why I imagine both of you are in that educational world too. It's just the best. It's just the best. So. Wanted to ask both of you, what's on your bookshelf right now, or what's on your nightstand, or what are you reading these days?
I can tell you what's on
mine. If it's Nicholas Sparks or something like that, or the Brittany book, that's totally okay too.
Verity by Colleen Hoover is actually on my nightstand.
All right.
Gosh, I don't even
have time to read.
I don't have anything that I'm reading right now, but I have a stack of things in my Kindle that I am hoping to read soon.
I'm a real bibliophile. I probably read 50 books a year or so, and I'm just always looking for new ideas. But no matter how high that stack of books that I want to get through, even if it's virtually high, ever gets, I'm never going to be able to get through everything. It's a moment of acceptance when you realize I'm never going to be able to read everything I want to read in this lifetime.
Well, I have about an hour commute, and I had Greenlights by Matthew McConaughey on my Audible, and not only was that a great book, but he read it in such a interactive way that I really, really enjoyed that. So that might be something, if you haven't already listen to that one. That's definitely a fun one.
It's in the stack.
Yeah, it's near the top. It's great. It's very motivational. He's really funny in it. You can see the stories that he's telling. So
I would expect nothing less from somebody with his talent.
Yes.
Yeah. And so for my last question that I ask every guest is, and I'll ask both of you individually, but if you had the opportunity to have the biggest billboard on earth on top of the world's highest mountain, what is the message that you would want to broadcast for humanity?
Oh my goodness. I think for me, it would be recognizing that everybody is always going through something. And I had this example today with one of our students and had no idea that the student was going through what she was going through until she shared it. And so I think that would be my biggest thing, is always be kind, because somebody's always going through something, most likely worse than what you're going through.
Yeah. How about you, Carrie?
Yeah, the first thing that came to into my head, not to steal from Sarah, but was something along the lines of be kind, but I think also just acceptance. Just no matter who you're dealing with and how they identify, what type of life they live. Just try to meet people where they are and accept them as human beings.
When we talk about suffering, I've heard it said that if you get everybody together and you throw all of your problems into the middle of a circle, people would be pretty quick to go out and pick up the problems that they already have instead of picking up somebody else's problems, right?
Yeah.
And I love to know that that you've got students out there that can confide in you, and other people nurses that can confide in you whenever they are struggling with those very human emotions, the total human case of we suffer, right? We suffer. And that's where compassion comes into play. Yeah. Well, I want to thank both of you so much for being on with me today, and for using my book to teach students. I'm always excited to know how the book is being used. And again, listeners, if you know of anybody out there who's in the nursing journal publishing world, wants to look at their research, we'd love to have it get out there and be published a little more. So Carrie and Sarah, thank you both so much for being with me on Compassion and Courage today.
Thank you so much for the invitation.
Thank you for having us.
Yeah, absolutely. It's been a pleasure. And listeners, thank you too for being on this episode of Compassion and Courage, Conversations in Healthcare. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. Remember, check out marcusengel.com for your keynote speaking needs, compassion consulting, books, etc., etc., etc. Thank you so much for being part of this episode of Compassion and Courage.